Tonight, we're taking a look at the coronavirus crisis from a different perspective. The people who deal with all of those who have lost their life to the virus. First, a look at the latest numbers. There have been 418 deaths in Missouri of people who tested positive for COVID-19. In Kansas, there have been 147 deaths. Both numbers climb daily.
First responders and healthcare workers are crucial in treating and caring for COVID-19 patients. But with rising deaths from the virus, another important group of workers sees its impact firsthand. KCTV5's Nathan Vickers shows us what work has been like for them.
Dealing with death is always part of the job for Michael Diak.
Families have been really great, they're understanding.
But lately, he and Matthew Seago have handled more loss than usual.
What we're going through now is something else.
They run Complete Cremation in Harrisonville, a business seeing a surging workload.
We're working a very difficult job, and right now the demand is high. It's just like it's nonstop.
Their crematorium has handled at least 12 coronavirus deaths. But part of their new caseload comes from families choosing to cremate instead of holding traditional burials.
Usually when you have a viewing or a funeral, you've got a lot of people in close quarters giving each other's hugs and kisses and shaking hands, and those are all things that just can't be done right now.
I could have never imagined that it would happen at a time like this.
That was the case with Lana Johnson's family.
Nothing is easy when it comes to planning services, I will tell you.
Johnson's grandmother died in hospice care in April. Even though it wasn't COVID related, they couldn't hold a traditional burial.
Put trust right now in the process. Stay safe.
For many families who have lost people over the past few weeks, one of the most difficult things has been not seeing their loved ones in their final days.
That is really difficult on people because typically, pre-coronavirus, you could be with your family member in the hospital, and you just can't do that right now.
Diak and his employees take universal precautions with all of their cases. But right now, they're also adding safety equipment and treating each one as if it could be infected.
Needing to do more with facial protection, masks.
They're experiencing a pandemic firsthand, too.
It's a very contagious virus, but ultimately it really becomes our personal responsibility to keep ourselves clean, to keep ourselves away from people.
They work to bring rest and comfort in times of crisis. In Harrisonville, Nathan Vickers, KCTV5 News.